Welcome back, everyone. Fingers crossed. Fingers crossed, everybody. Fingers, toes, eyes, legs. Let's do it. You know what?
Woo!
You know what? And we're live. So I'm just gonna keep it together. We're lucky we're friends. Everyone, ignore this conversation right now. You are lucky we're friends. Okay. Production, thank you so much.
Yes, thank
you, everybody, for your patience. Welcome, Dr. Siddiqui. So without further ado, because we have people that are literally chomping at the bit. Can you turn down your phone a little bit? There's a little bit of feedback there. Literally, folks are chomping at the bit to hear what you have to say about race-based data collection. And so I just want to take a deep dive right into it and start by introducing it. So, when they don't see us, the importance of race-based data collection with Dr. Arjumand Siddiqui. Arjumand Siddiqui is a Canadian research chair in population health equity and an associate professor at the Dalai Lama School of Public Health at the University of Toronto. Dr. Siddiqui is interested in understanding how societal conditions produce and resolve inequities in population health and human development across the lifespan. Her research focuses primarily on the roles of resource inequities and social policies, the method and metrics that enable scientific inquiry on health inequities and mechanisms related to public and political uptake of evidence. Dr. Siddiqui is also an invaluable member of the CRIB's Global Community Research Network. And she is also, on a personal note, someone that I've known. Has it been 25, 30 years? How long?
Long ass time.
It's been a minute. So some of you may hear me sort of go into my personal mode with her and say Siddiqui rather than Dr. Siddiqui, but I welcome you to 30 at 8:30. Thank you so much.
Thank you. Apologies for the technical difficulties.
It's all good. You're here now.
Yes.
I'm looking at my notes. I'm just, and people are, okay.
I was like, I'm on here. I don't know why I'm not on here.
And clearly the CRIB community has shown up and shown out, and they are ready for this discussion. So I'm just going to dive in. Siddiqui, hot off the press, Toronto Public Health will start collecting COVID-19 data on race to track health inequities. Thoughts, comments, praise dance. What is going on? Tell me, what are your thoughts?
So I think this is the result of social movement. This is the result of people putting a lot of pressure in a short amount of time on the government, and you saw that with many op-eds, many pleas in different social media venues, and so on. So I think this is something that you could directly trace to social mobilization.
Wow. And because you have been talking about this for at least a decade. And so it's interesting that last week we were talking about the whole idea, and I looked into the conversation, the idea that from this, I want us to move from a moment to a movement. And here we are. I was just blown away, and I could not wait to talk to you about it. I could not wait. So social movement. W.E.B. Du Bois observed that the most difficult social problem in the matter of Black health is the peculiar indifference, if you will, of the nation toward the well-being of Black people. Will highlighting disparities with the collection of race-based data be enough to move us toward changes in policy and practice that address the issues of structural inequality?
No. It's not even close to enough. I think if you take Du Bois's words in fuller context, one of the observations he had was a sort of political economy of indifference. So it's indifference, but it's not actually indifference per se. I think inequities will persist as long as they are useful to people in power.
Oh, can you, I'm sorry, Siddiqui, can you just drop that again for us?
Inequities will persist as long as they're useful for people in power.
Woo! Okay.
So
continue.
I think the data issue is very much an entry point into being able to provide a sense of what's actually going on, a public record of what is happening that allows us to have discourses within our community and between communities that allows us a tool in the fight. Without it, it's sort of like it's necessary. It's necessary, but it's nowhere near sufficient. I think it's indispensable, and at the same time, we should know that it's nothing compared to the monumental task of dealing with this stuff.
Thank you for that. So, switching gears a little bit to the Canadian context, or merging the two, if you will, U.S. and Canadian context. Early data from a few U.S. cities, Milwaukee, New Orleans, Detroit, New York, etc., indicate that African Americans have contracted and are dying from COVID-19 at an alarming rate. However, both United States and Canada as a whole have not begun tracking the impact of the virus by race. How does the lack of race-based data still not being collected by countries as a whole affect our ability to respond to the impact of COVID-19 pandemic on vulnerable communities?
So again, I mean, sort of in follow-up to the first answer, I think without that data, it's impossible to have a sense of what's happening and to whom it's happening, and what, to hold the powers that be through various tools we have somewhat accountable for what's happening. If not even just materially accountable, which is what one hopes, but morally accountable and so on. I think I would still draw a distinction, though, between the data that we have in the U.S. and the data that we have in Canada.
Talk to me.
So the data that we have in the U.S., I would be surprised if there isn't more individual level race data available that hasn't been released in one way or another.
I agree.
Whereas in Canada, we are struggling with even just core basics. I think if you think about the U.S. data that does exist, we do have data on aggregate race statistics. So we know, for example, how many Black people there are, what proportion of Black people there are in a particular county. And we also know how many COVID cases and deaths and so on there are in a county. Right. So at the aggregate level, we can say something about not Black people individually, but Black communities. And that's not something we can easily do in Canada. We can do it a little bit better than we are doing it. There's no question. And so there is more potential in Canada than we are allowing for. And I think it's maybe useful to draw a distinction in two things. One is whether data are available, like whether they actually exist, and whether they are accessible. So one of the big problems in Canada is, even insofar as there is data that's available, it tends not to be very accessible. And so you see, for example, that county level data I mentioned in the US, where you can figure out how many Black people live in a county, what proportion of Black people live in a county. You could figure out something similar here using census statistics, but in the US, we can download that data off the internet and start analyzing it. And in fact, that's exactly what my team and I are doing right now.
Yeah.
We can't do that in Canada because in order to analyze that data, you have to go to a Statistics Canada research data center. And so what ends up happening many times is that either the barriers are so high to accessing the data that people take a long time to do it, or it's such it dissuades people from doing the work so much because the barriers are so high that they don't do the work, and most of it is left to Statistics Canada to see what they're going to release and how they're going to release it. And so the idea that you don't have independent scientists and independent individuals in society that are able to independently analyze the data that we have is a much bigger problem in Canada than it is in the US.
I want to touch upon something that you just said, because I'm hearing accessibility here in Canada, right? So what is the pathway forward? Is it simply just access? Like, what would it look like if you had your druthers to be able
give us free? That's the way forward. That is the way forward.
Did you say give us free? Did you?
I'm just saying.
Oh, righty. You were like plain and simple, straight no chaser.
Just release it and let us analyze it. Because it's so problematic that it's public data and not publicly accessible.
I was blown away. You know the story. You were the first person I called when I was coming here and preparing my job talk, and I was just awestruck by the fact that I couldn't get access, and that that wasn't being collected, but B, that it wasn't accessible. Oh, yeah. My gosh. Okay. So production is urging me on, but I mean, folks I don't know if you can see the comments, but folks are in it to win it. They are excited about this conversation. So I'm going to keep it going as long as folks will hold the space. I'm going to keep it going. So one of the things that I was picking up on, just looking at some of the newspapers and sort of the tweets, so emerging out of this global pandemic is also commentary that centers around blaming Black people for contracting and dying from the virus at an alarming rate. In other words, they're not social distancing, so forth and so on, as if to say that Black people are to blame for their own demise. How can the collection of race-based data help to dispel this myth?
So there's two answers to that. One answer is that we can ask questions that respond to the notion of how structural factors influence our health behaviors and behaviors like social distancing. For example, we might want to know whether Black people are systematically more likely to work in essential service jobs, are systematically more likely to live in dense neighborhoods, densely populated homes, buildings, communities, and therefore just not have the accessibility to social distancing that people in richer, whiter communities have. But there's another piece to that, which is that it's almost, in some ways, a really sort of bad starting premise to accept baseless comments and then try to respond to baseless comments. It's not just a losing proposition. It's like it's a waste of time. Yeah. So I find this many times when I think about the HIV literature, which I know little about, but what little I do know suggests higher rates of HIV in Black people, but actually the same or better sexual risk behaviors in Black people. So the reasons for HIV spread are not related to sort of bad behaviors in Blacks. We found this, actually, we did a study using NHANES, which is the National Health and Nutrition Examination Survey in the U.S. Same thing goes for diet and caloric intake. Higher obesity in Blacks, but actually in that data, Caloric intake was no different for Blacks than for whites.
Yeah.
So, we don't have any reason to believe that Blacks behave badly. That is a starting premise that is not empirically founded.
Mm-hmm.
And so, on the one hand, we have to contend with it because powerful people and powerful narratives put that out there. Powerful people and powerful narratives suggest to us that these issues are best viewed in terms of individual sort of stupidity and community dysfunction. And so in some ways we have to fight back and we have to interject in the narrative.
That's right.
But it is important to recognize that it's a narrative that is fundamentally unfounded.
Yeah. And I heard someone, I saw Daphne Watkins, need to develop a counter narrative through all of this. It's just striking to me, and I kept saying over and over, and I, throughout this whole process, I'm sort of jotting down notes, I'm journaling, as I'm receiving information and sort of digesting it, both on a very personal level, but as a community-based researcher as well. And I just keep this track keeps playing in my head, that Black people are not dying from COVID-19. They are dying from structural violence in the form of racism. Period. End of story. Done. And so you've really kind of cemented that notion here. People want to ask you questions. And so I want to open it up, but I want to actually ask you this last question that we've been asking of all our guests. As we move through this global pandemic and consider the disproportionate impact of COVID-19 on some of our most vulnerable, what might be the call to action? What might be the call to action for research, policy, and practice?
I think we have to contend with the way we fundamentally structure risk for illness in our society. So what's happening with COVID-19 is no different than what's happening for any other health outcome. And I was actually asked this the other day on a webinar. What is the question we could ask in the short term? And I'm an epidemiologist. I, as you know, work with data. But I honestly think the most important question with which we have to contend is how we fundamentally accept the way that risk is structured. And I sort of say that tongue in cheek because I think, as I said at the outset, we know why we accept this. We accept it because there's a utility to it for people in power, for whites, and particularly rich, powerful whites. But I think at some point we're going to have to recognize that COVID-19 amplifies in a short, intense moment things that are happening in every illness, in every social and economic outcome that we can think of. And that's why data is not enough, right? So data we have data on this other stuff. So it's necessary, but it's not nearly enough to address the main issue, which is that society fundamentally structures risk so that no matter what comes up, whether it's heart disease or COVID-19, you're always going to see that people with less material resources and less power, most notably Black people and First Nations people, are going to bear the brunt of almost anything that you can think of, because we fundamentally set up society to offload risk to those people.
Wow. I mean, just fire. Thank you.
She says that now we're going to get off and she's going to call me and be like, you really couldn't get on time?
Absolutely. But that's the sidebar. I mean, that's the sidebar. I want to keep this conversation going because we've got some questions, Siddiqui. So bear with me. I'm going to read them and just kind of do a quick Q&A, if you will. Do you think race-based data would make a difference when those lives are viewed as dispensable, is the first question. Do you think the collection of race-based data would make a difference when those lives are viewed as dispensable?
I think it depends on whether we can use race-based data to highlight the problem and then use particular tools we have in society to hold powers that be accountable. So I don't think the presence of data is in and of itself enough to move the people who are in positions of power. But I think having the data provides tools to our community, tools to people who are fighting the good fight, in order to mobilize in the service of making progress. So it may, for instance, help us to refute this idea that the chief medical officer, David Williams, had put out there, that we shouldn't care about race because we're interested in the health of all Canadians, which was stunning to me, because the very reason we're interested in what's happening in long-term care homes is because we're interested in populations that are at higher risk. We can say the same thing for prison populations, about which we've heard very little. Another institutionalized population that, in fairness, it has a different age distribution than long-term care homes, and so it may look different, but nonetheless, there has to be a point at which we at least make those powers face a set of facts, so that when they are arguing whatever they're going to argue, it's really important that they not be able to root their arguments in falsehoods. So to me, facts are important. And while I do not think the data is even close to the be all and end all, I think we can use it and other tools we have in society to hopefully make some progress.
Yeah, I hear that. Here's an interesting question. What happens when COVID-19 leaves? And we can dispute whether it will leave or not, but when COVID-19 leaves, what will be, or perhaps when we have vaccine, but what will these disparities look like? What will we see in terms of disparities, or what do you predict we'll see in terms of disparities that are impacting our most vulnerable?
So I think this could go a couple of different ways, but all don't look good for us. So one fundamental insight from public health, from population health, is that as diseases come and go, and I sort of alluded to this earlier, as diseases come and go, the burden of disease, whatever that disease is, whatever time period we're in, disproportionately falls on disadvantaged populations, on groups that have little power, little resource. And so post-COVID, my prediction is that you will see, whatever the situation is, whether that's a mental health pandemic, whether that's an increase in obesity because of lack of movement, whether that is, other fallouts from COVID, a lack of,
employment.
Employment outcomes. All of those things will likely disproportionately fall on Black and Brown people. So that's an insight that we've had from public health. It's been sort of true throughout time, that diseases come and go, and yet you still see this pattern emerge. Before COVID, we were mostly concerned with chronic disease in rich countries. Chronic diseases also disproportionately affect Black and Brown people. So that's one thing that I think might happen. My concern is that we will under document and therefore under acknowledge the extent to which that's true. And that could happen for a variety of reasons. One is the data issue that we're talking about. So we need data not only for COVID, we need data on race that is tied to our health outcomes. And we're in the ideal situation, because we have a universal healthcare system where all records are centrally kept. We have the ideal system in which we could collect race data and analyze it for the whole population in ways that actually in the US are not possible. So the US does it for routinely collected health outcomes that are sort of kept that are sort of kept for surveillance purposes. We could do it for everything because we have a system that would enable that, but we don't. And so my concern is that you're going to see a lot or feel a lot of disparities, but we won't actually know the true extent of what's happening. The other sort of sad prospect is that at the end of the day, partly what these disparities speak to is higher death rates in our communities and premature death rates. So that's something else to keep in mind, that the outcomes can be really dire. And it's great that they're doing this for COVID, but it would be really important to institute this sort of healthcare system wide. And I'm hoping that this step, which is entirely, again, due to the social movement activity that happened in the Black community in particular, I'm hoping that spreads sort of higher up the system.
Right. Production is telling me that we have to end, but I don't want to. And I'm going to give the last question to my brother Desmond. Thank you so much for joining us. Who says, ask the question, what are the best strategies for helping communities collect their own data? And I'm thinking about this in terms of some of the gems that you really dropped here today, in terms of, you know, having the thread and the movement and the pressure being sort of at the base of all of this, right? This place that we find ourselves in Canada in terms of collecting data, but also several folks sounding the alarm, if you will, about the need to do it on a more seamless level. So what are the best strategies for helping communities collect their own data?
So this is a little bit of a cop-out. I'm going to start by saying I'm not the right person to ask about community-based data. So I'm going to give an answer, but it's an answer said with a fair degree of humility because I don't know if there's a better answer. My answer, unfortunately, is I don't think that is the best way to go, because data collection requires reach and infrastructure that is not really possible at the level of community. So could it happen? Sure. But the very nature of what is required for systematic data collection and data collection at the population level, even community populations, makes it very difficult for it to be the job of a community to collect their own data. Now, I will say there's some things that you could do within community institutions to collect data that may have some impact in terms of how you choose to advocate, what kind of community level programming you decide should occur. And of course, community agencies do that kind of data collection quite often. But the question of answering, like, what is systematically happening requires a level of infrastructure that is very difficult to do at the level of a community.
It's an interesting question, Siddiqui, and I think that you're bringing up some interesting points, but I don't know. You know, I'm always the dreamer, and I'm a community-based researcher, so we come from two somewhat different worlds, but certainly joined at the hip with the same passion and commitment to being of service for our people. I'm just wondering if systematic data can also be collected, but there's an opportunity here to perhaps talk about systematically having communities or community agencies that are serving some of our most vulnerable populations learn how to systematically collect data, through technology, through different sort of tech. I just wonder if those things can coexist in a way that they're informing one another. I think about some of my, colleagues who at the School of Social Work at U of T who've come up with some innovative ideas to be able to collect data regarding the impact of COVID-19 on mental health outcomes, and doing that through community-based initiatives. I'm just wondering if there's a way to do that, but
there's certainly ways to do that, and I think community organizations do that. I just think it's not the same goal as understanding what is systematically happening to communities.
Yeah. Oh, I hear you.
Right? I think that's the issue, is it's not a substitute.
Yeah.
Community-based data collection isn't a substitute for massive population-wide sort of ability to track over time, particularly what's happening to populations.
I hear you. And wow. I've been so excited and looking forward to this conversation, just constantly reading and constantly just talking to you on the daily. And so I can't thank you enough for the work that you do, but taking the time out again to join the CRIB community, to hold the space at 38-830 for vulnerable populations.
Or 30 at 8:45 today. So.
Oh, did you see that? Did you all hear that? She just said 38, but whose fault was that?
Not mine. Nobody told me I couldn't go on my computer.
Just wrong. My fellow CRIB community folks, thank you so much for joining us this evening. Your comments, your gifts were fire. Thank you so much. If you want to reach us, please be sure to direct message us at the CRIB community, or you can contact us, follow us on Instagram, my production manager on the laptop. Follow us on Instagram or Twitter, or if you've missed this segment or want to rewatch it, our stops and starts, Siddiqui, please don't forget to follow us at www.the-crib.org. And again, as always, until next week, from our crib to yours, stay safe and keep well.
Thank you. Bye.